Hello and welcome to today's video and podcast. I'm Don Linsman, Executive Director of Marketing and Development at Crawford County Memorial Hospital. My guest on the podcast today is Dr. John Hoagland of Vision Care Center here in Denison Vision Care Clinic. Dr. Hoagland graduated from Morningside College, and in 2019 he graduated from the Southern College of Optometry and received his doctorate of optometry there. Dr. Hoagland is a current member of the Iowa Optometric Association and the American Optometric Association. And Dr. Hoagland, thank you for joining me today.
Thanks so much for having me, Don.
So the reason that I have you on our video and podcast today is because June is Healthy Vision Month. And as odd as it may sound, Dr. Hoagland, I think there are an awful lot of people who do take their eyesight for granted. They don't really think about it a lot. It's not really one of the things that comes rapidly to mind for them most of the time, but it is something that we need to pay more attention to. And I think probably the way we start today is by just talking about how often should I get an eye exam?
Yeah, excellent, Don. That's a great question, and I think you're absolutely right. You know, we do sometimes take the things that we have for granted, including our vision and our eyesight. We here recommend yearly eye exams for most individuals, and the American Optometric Association would recommend at least every other year, even if you're perfectly healthy and normal. Time just has a tendency to get away from us all. We live busy lives, and building that relationship year after year fosters a healthy doctor-patient relationship, and it really does improve outcomes and benefit people who are committed to that yearly eye check. And we know that there are threats to the vision that sometimes present without symptoms. So we do recommend yearly eye exams for nearly all of our patients, and do feel that that is a significant benefit to them.
So Dr. Hoagland, one of the things I think people have to keep in mind is that there's more than one way to actually perform an eye exam, and probably the one that's recommended more than others is a dilated eye exam. And can you just tell us for a minute about that?
Yeah, so a comprehensive eye exam, especially including a dilation, really allows us to look all the way around the back of the eye into the retina. I always use the comparison of looking through the window of a door versus opening the door. With the dilated pupil, we're looking into the back of the eye with light through that small black pupil. And so the dilation allows us to expand the colored part of the eye, the iris, to give us a more complete and clear view of the back of the eye, to make sure that we're not missing any small subtle changes. So it does definitely make a big difference as far as the clarity and the quality of the exam that we get. And so we do commonly perform dilated eye exams for our patients. And while it may not need to be every year, the dilation is certainly a significant added benefit to that exam. And we actually have some new exciting technology in our offices as well, something called an OptiMap, which is a wide angle retinal photo. And so the photo allows us to see out to the edges of the eye, even without the dilation. And so that's a good option for people who may be very sensitive to the dilating drops, or who may be need to avoid the dilation that day for something like family photos.
So Dr. Hoagland, just to touch on this briefly, if you have a dilated eye exam, should you have somebody available to help drive you? I mean, is that a concern?
So that's a great question too, and a common misconception. There are individuals, especially farsighted individuals, who, when they're dilated, their vision can be significantly impacted in their ability to drive. However, the vast majority of individuals, especially those with a good glasses prescription, shouldn't have trouble seeing far away to drive and navigate back home after the dilated eye exam.
Okay.
We do recommend sunglasses, though. It gets pretty bright.
Okay. All right. Well, that's good to know. So the thing about eye exams, and I know that as we all age, you know, our eyes in particular change. I'm not as young a man as I used to be. I know it's hard to imagine, but I'm getting older all the time. And one of the things that I do wonder about is, do older adults tend to have more eye problems?
Another great question. And as with most organ systems throughout the body, over time, things do tend to break down and deteriorate a little bit, and the eye is no exception. So we do tend to see a little bit of pathology in the eyes with older individuals. However, there are other factors that we're coming to find out more and more about that can cause some of these aging changes a little bit earlier on. Some of those include UV light exposure, smoking, or poor nutrition. And so even younger individuals, again, we see some of these changes. A lot of patients are coming in with more symptoms associated with dry eye, computer vision syndrome, just from those long hours spent in time in front of a screen or a computer. We're all doing more and more computer and screen time these days, and that certainly impacts the eyes in ways that we probably don't fully understand yet. And so while there are, in generality, more concerns for aging eyes and eyes in older individuals, we do see a variety of different concerns, questions, and problems for all ages.
How about children? So I know that kids will be going back to school here in late August. What about kids? Should they be getting eye exams before they go back to school?
Definitely. So that's so important, so important. And with kids, one of the challenges is they oftentimes can't tell us the trouble that they're having, especially younger kids. They've always seen that way. And so until they come in for an eye exam with us, we don't fully understand that they may be having limitations on their vision that are causing them to struggle in school or may set them back in school. And so we definitely recommend having a comprehensive eye exam for kids, probably sometime before kindergarten, ideally. But I know through the school system, they do a great job of encouraging at least kindergarten eye exams at age 5. But we do see kids anywhere from about 6 to 9 months all the way up. And so we're doing some detection and screenings that way as well. The biggest threat for kids is really, again, uncorrected refractive error, which means nearsightedness, farsightedness, or astigmatism. That's going to limit the way that vision and their associated visual systems develop. And really the critical period ends sometime between age 7 and 9. So, if we don't catch things until kindergarten, we've already missed a significant period of growth and development. And so it's a major concern, and it's definitely something that we're always trying to improve awareness of.
My guest on the video and podcast today is John Hoagland. John is a doctor of optometry, and he's at Vision Care Clinic here in Denison. And we're talking about healthy vision because July is Healthy Vision Month. And I think one of the things that I think about sometimes is what kinds of eye conditions are the most common?
That's a great question. And really, refractive error, the nearsightedness, farsightedness, and astigmatism are the most common, and that's what we see the most of because nearly everyone has some amount of refractive status one way or the other. And about 75% of the population has some amount of astigmatism. So those are the most common, but some of the more fun and interesting things that we see and that we deal with on a day-to-day basis include cataracts, dry eye, macular degeneration, glaucoma, and various injuries or infections of the eyes.
John, what about family history? What about genetics? What does that mean? What kind of a role does that play in someone's eye health?
Yes, absolutely. Great question. So genetics is something that I definitely am interested in, and I think we'll continue to learn and grow in our knowledge of the way that genes affect the eyes and the body in general. And family history is something that we're always asking about and always thinking about. Two conditions that we mainly focus on with family history are glaucoma and macular degeneration. Especially in this area, macular degeneration is unfortunately quite prevalent. And we know that there's a strong association between genetic history and the onset of some of those macular degeneration changes.
Mhm.
So with our continued improvement and understanding of genetic risk factors, I think that we'll continue to see growth in our detection, understanding of the processes that these conditions go through and cause for us, as well as our treatments in the future. At Vision Care Clinic, we actually work with a group called Visible Genomics, and we do offer some macular degeneration genetic testing to help establish a risk profile for our patients who are interested in that.
You mentioned something just a little bit ago, and it spurs another question, and that you talked about eye injury. I at least as far as I'm concerned, most of the time when I think about people with eye issues, it's because they're getting older, or you need glasses, or you need a different prescription, or whatever. But eye injury is probably one of the bigger reasons why we have people with vision loss. So maybe for a moment, you can talk a little bit about what we can do to protect our eyes. What can we do to protect our vision?
Yeah, that's a great question. And it's really unfortunate because, like you mentioned, a lot of the individuals who suffer vision loss who are younger, many of them it is a traumatic or an injury cause. And we do see that a lot here. Some of it comes down to eye protection, not just in your workplace, but around the house as well. When you're running the trimmer and weed whacker, you have to be aware that if you were to hit a rock or if something were to come up and strike you in the eye, if you don't have protection, that unfortunately that can be a vision threatening event. And it's not something that any of us would ever anticipate or expect, but certainly we want to try and mitigate and avoid those as best as possible. So caution around, outdoor power tools, any woodworking, as well as different chemicals, and just making sure that you're wearing proper eye protection, especially around the home. We actually were taught in school that more eye injuries happen around home and around the house than actually in the workplace. And much of that is because of mandates at work to require safety glasses. But certainly the risk from the workplace still exists. And we see patients frequently with ocular foreign bodies, whether it's metallic or vegetative matter, those sorts of things. So just don't forget to be a little bit conscientious of the risks to your eyes when working around the house.
I wear my protective glasses every time I vacuum. So I just, in case there's any foreign bodies in the carpeting, I'm covered. My guest on the video and podcast today is Dr. John Hoagland. Dr. Hoagland is with the Vision Care Clinic here in Denison. He is a doctor of optometry. Dr. Hoagland, if I have vision problems, can that lead to other issues with my overall health?
Absolutely. So, general health and ocular health are tied closely together, and there are risks associated with having poor vision, and they do tend to cause deterioration of your general health. So, some of the primary things that we think about, again, vision just so important for navigation and safety. So, we've done a lot of work with different programs to increase awareness of cataract progression and the risks that are associated with cataracts and avoidance of cataract surgery and the association with risk of a fall. So for some of our older individuals, already having a little bit tougher time seeing as their cataracts get worse, it's easy to miss a stair or step off a curb wrong, and take a fall. And we know that that can have catastrophic outcomes for general health. And so the eyes are very, very valuable and very important in our overall maintenance of health. And so certainly we want to protect that precious gift of sight to again support health elsewhere as well. So there are some strong correlations there. And the comprehensive eye exam positions us uniquely as well to take a look at the blood vessels. So the eye is one place where we can look at the blood vessels without doing an ultrasound or cutting into someone. We can use the light and see the blood vessels of the retina. And we can use technology to map the deeper blood vessels in the eye as well. And so we're able to screen for things like high blood pressure, diabetes, or even stroke risk, which is becoming another topic through just that comprehensive eye exam and monitoring things that way. So there's a strong link between your general health and the health of your eyes. And so that's definitely something that we keep in mind.
I only have one question left today, and I want to go back to where we started and talk about eye exams for just a minute. I know that I have floaters, and I'm sure that there are other people who are my age, younger maybe, older maybe, uh, floaters, halos, um, double vision. Maybe there's something else going on there. I mean, is there anything in particular we should be really concerned about when we go into an eye exam? Anything that we should be sharing with our optometrist when we go in to have our examination?
Yeah, absolutely. Again, another great question and a conversation that I have a lot surrounds those floaters, and the concerns that those can bring on for people. On one end of the spectrum, you have the person who's kind of in denial or disbelief that that could be going on, and maybe they're just seeing things. And on the other side, you have, the person who's overly concerned and worried. But either way, rightfully so, they've made the correct decision to at least consult with us and come in and let us take a really good look. So what we're really encouraging patients to do is if you have a significant change in your vision, whatever that means for you, and it's something that you're increasingly aware of and bothered by, it's always a great idea to call in, tell us a little bit about your symptoms, and we're really good about being able to kind of triage that and tell you how urgently you should come in and see us, and schedule you to come in for that evaluation just to make sure. So some of the biggest symptoms that we ask patients to watch out for year to year are new severe vision loss, wavy, distorted, or missing areas in their vision, new flashes of light, like a lightning strike or a camera flash off to the side in your vision, and also just changes in the side vision in general. Unfortunately, though, a lot of the early symptoms in things that we watch for are rather subtle and can happen only in one eye. When we walk around with both eyes open day to day, we don't always notice small changes in one eye or the other. And so that's where sometimes we don't discover some of these early symptoms until they're in an exam with us, and we ask them to cover one eye to read some of the letters for us, and they notice that, oh, that eye's not seeing quite as well as the other. So that's where, again, that comprehensive exam year to year really does make a big difference, because there are so many things that we're worried about that don't always present with immediate concerns or symptoms. But certainly, if you have big changes to your vision, flashes of light, new showers of floaters, that's definitely a time to contact us and come in and get everything checked out to make sure that everything's staying healthy.
So July is Healthy Vision Month, and if you haven't gotten the message from our podcast and our video today, I'll just say it one more time. If you haven't had your vision checked recently, you need to make an appointment and have that done. We can't be too careful with our eyes. It's the only set we're going to get. I don't think there's a transplant yet. I mean, I don't realize cataracts, but for the most part, I don't think there's any other way to go except take care of the ones that we have. My guest on the podcast today has been Dr. John Hoagland. John is a optometrist at Vision Care Clinic. And Dr. Hoagland, thank you for your time today.
Thank you so much, Don. My pleasure.
I'm Don Lintzman, Executive Director of Marketing and Development at Crawford County Memorial Hospital. We care for life.